This is a brief video. I'm going to focus mostly on Heather's knee, but I'll quickly point out that both of her ankles are fairly rigid with passive dorsiflexion only to neutral. And that might be from habit, i.e. playing volleyball with lots of deceleration. So we will test and see if we can mobilize the talus into posterior glide and posterior rotation and gain more. I'm sure the camera angle can't quite capture that limited dorsiflexion, but anyway. The other thing that really has my interest is the right knee. When I test accessory motion in the knee, just an AP spring on the tibia, an AP spring on the femur. She has mobility on the left and throughout the left knee. When I squeeze the patella, I can get underneath it a little bit and get a little bit of patellar lift. I can glide the patella medial-laterally. On the right side, the patella does not have much medial-lateral excursion, and when I try and reach underneath and clasp it to lift it, I cannot do so. When I spring the proximal tibia, there's no mobility there. When I spring the distal tibia, I can't even take up the slack, so I can't spring it. On the left knee, when I lift up the lower leg, she hyperextends more than 5 degrees. I'm going to call that 10 degrees. And the right knee, I can't lift it up, so she does not passively hyperextend. Interestingly, it appears that her distal femur is stuck in posterior glide. It's been an interesting 3 weeks because this is the third person I've seen in 3 weeks with this pattern. Now, it's hypothetical at this moment. The proof is in the pudding, so if we can change that relationship, then I will be able to affirm that. It is a subtle finding, but a very non-subtle presentation is the degree of knee flexion. So if you could lie on your stomach, please. So I will first demonstrate knee flexion on the left side. There's 90 degrees. So I can take her to at least 110, maybe 115. Okay? A little tight in terms of norms, but we're going to call this her norm. I did screen the hips also. Right knee becomes very rigid right at 95. I cannot bend that any further using a moderate amount of force. So that's 95, maybe 100, but it's considerably less than this side. Okay? So I am going to attempt to treat the right knee by restoring anterior glide of the distal femur. And we will then see if that changes her range of motion in prone passive flexion. We'll test patellar mobility, and we'll test the anterior to posterior spring at the tibia and femur. So I'll stop filming now and we'll come back to this in about 5 minutes. Thanks.